Hi, my name is Amrita Mishra. I'm representing the Indian Association of Nashville, and with me I have Dr. Anuradha Mann. You've had a conversation with Anuradha Mann earlier in the March during Women's Day event, and during that time we had a conversation on coronavirus and what we expect. Now, 6 weeks down from the lockdown, we want to touch base again just to know what are the new things that's happening that we want our audience to be aware of. And I just want to inform the audience that we in Indian Association of Nashville are committed to providing our resources with all kind of information that will help them through this process. And we absolutely encourage our audience to reach out to us whenever they have a question. And whatever we can do in terms of helping and supporting, we are here for you. With that being said, Dr. Anuradha Mann, welcome back. How has the lockdown been treating you?
Well, I'm sure it's treating all of us very differently, and each one have changed our lives in so many different ways. But I think we have to do this, and probably for the next 1 year at least. But I think we need to at least follow the rules and guidelines where there's science and data behind, instead of getting caught in the panic and being helpless. So I think I've learned a lot from the lockdown.
Yes, yes. So I know the last time we discussed coronavirus and the symptom, it's been a while. So have there been new symptoms that has come out from six weeks process that has gone into it, and what are the new things that we have learned along this process?
Well, Amrita, as you know, the most popular symptoms that everyone has heard about is a fever with shortness of breath and the dry cough. So now there are more symptoms that have evolved as we've learned about the disease. And of course, body aches, fatigue, sore throat is another one, headaches, also nausea, vomiting. And some people, they can just have diarrhea where they cannot find the reason for that. And there's been a lot of reports in some people where they've had loss of taste and smell.
Okay, okay. Social distancing is the new norm now. So, what can we expect from this phenomena? Like you said, this is going to be around for a while. So what can we expect, and what more can we keep in mind when we talk about social distancing, or we speak about this topic on social distancing?
That's right, Amrita. Well, all of us know about the 6 feet rule. If you go to whenever you step out of the house and go to even essential need places such as groceries, pharmacies, physician offices, etc., you have to maintain that 6 feet distance. Try not to go at a time when places are crowded if you can afford to. Like grocery stores for seniors they've come out with special timings. So try to go during that time. And also make sure you take your mask and the sanitizer, and make a list and see what you need. And that way you don't spend too much time, so you know exactly what to pick up and you're in and out quickly. So that's a way to practice social distancing, because if you are there for too long, you might accidentally get exposed to someone who don't have symptoms, but they're carrying the virus around. And that's the place where the mask comes in handy. And not only is the cloth mask helpful to prevent your secretions from going somewhere when you cough, it contains it, but also you don't get the coronavirus from someone who doesn't have the symptoms if you're wearing the mask. And also, if you're going to a pharmacy, use the drive-through. Grocery stores are offering, obviously, online and home deliveries, and there's a lot of volunteers in the community also picking up for senior citizens. So do that. And also call your doctor's office when you have to go for a visit as to how they are practicing social distancing, because every office they come up with different strategies about following social distancing.
Sure, sure. Speaking of mask, I mean, this is the mask that my employer gave to all of us, and this is the KN95 mask that we have been given. Is this the only and the best mask that is recommended? Or if not, then what are the other options that we can, think of or have that as an option?
Yeah. Well, I'm glad you asked me that question, because people are buying up all the masks, and the healthcare workers running short of these important medical masks. Some of them are called the respirator, like the N95. So the CDC actually came out with guidelines earlier in April and actually recommended that the public not go after the medical mask, just a cloth mask that can be made very simply and in very little time at home. And I have one of the cloth masks that I can show, and it's literally a mask where it covers your nose and mouth, and there's a little fold over here, like 3 folds, so that you can pull it up and then cover your the nose and mouth. And as you know, the statistics that an average person touches their face every 2.5 minutes. So just having the mask on prevents you from touching the nose and the mouth and even the eyes, just by nature of having the mask on. And because that's the areas where the coronavirus enters from your contaminated hands into your body through the mucous membrane of the nose, mouth, and eyes. And also, American Academy of Ophthalmology have recommended that people avoid wearing contacts, because when people wear contacts, they tend to touch their eyes just because it's irritating. So that's something important.
Right, right. So, speaking about drive-through tests, I mean, I know we have heard communication coming out from different government agencies that drive-through tests is being offered. So, what can we expect from this program when we go into it?
Well, our governor of Tennessee has been kind of very aggressive, and he's started the drive-through testing about 2 weekends ago. And at 33 locations, you can pull up the locations on the Tennessee.gov website, and there'll be timings there and give you instructions as to how to show up there. And pretty much the test involves you're in your car, and the healthcare worker or the person who's doing the testing, they take this long stick, which is like a Q-tip, but they put it through one of your nostrils to reach the back of your nose to collect the secretions, and they send it out to the labs, and you get the results in about 24 to 48 hours. And so that's something of importance, because people who have no symptoms and they just want to know if they have the virus, one can go and get checked out. And I think as more testing becomes available, I think this is the way to go to know how much of the population have actually gotten the disease, because some of them may not have totally any symptoms.
Sure, sure. That's great information, Dr. Mann. So coming to the new buzzword in town, which is telehealth, and we know this telehealth has been around for a really long time, but now it's suddenly gained a lot of popularity. So what do you have to comment about telehealth as a program now?
Well, telehealth is a way of taking care of patients without the patient coming to the office. So pretty much it's done remotely, just like how we're doing Zoom video meetings, etc. Telehealth is a new platform for medicine. Actually, it's not new. It's been around for 5 to 10 years, but most patients like to go to the doctor to be seen. So now a doctor can call you on FaceTime, but the doctor will ask you to check your blood pressure, your temperature, and pulse rate, if you have a way of checking it, and then have that ready. And then the nurse will go over all the medicines, and then the doctor will talk to you like on a video call and get all your medical illnesses that you've been needing care for, like high blood pressure, diabetes, or any illness where you need to see the doctor on a regular basis, but you're scared to go to the doctor's office because you're worried where you might get exposed to the virus. So this is a new way of making sure you take care of your chronic medical problems without risking yourself of getting exposed.
Right, right. That's good information. So, and this applies to a lot of people with chronic medical conditions. So this will be a good way for them to constantly be in touch with the doctor without going through the ordeal of driving to the ER and meeting them. So this will really take care of a lot of that population with that, right? That's
Absolutely,
good to know.
and that way you can avoid going to the ER and take care of a lot of your problems by just doing telehealth.
Sure. Okay. Coming to drugs and treatment, I mean, there has been some controversy going around Advil. So what do you have to comment on that?
Well, we don't have any solid data and about all these anti-inflammatory drugs like Advil, Aleve, ibuprofen. They fall under the category of NSAIDs, non-steroidal anti-inflammatory drugs. There's been some anecdotal reports saying that these drugs can actually cause a person to get more serious illness if they get the coronavirus, but there's no hard proof for that. So because we don't have any data to back up that, we are recommending people to take Tylenol or generic acetaminophen when they have a fever. But at the same time, there are some people with medical illnesses where they have to take these medicines on a regular basis. And so we don't recommend that you just stop the medicine, but consult with your doctor before you stop it. But there are some people where they cannot take Tylenol and only the Advil works. So in those people, we recommend take the lowest possible dose that is going to be effective for you.
Okay, all right. Now, coming to mental well-being, I mean, we are waking up to bad news almost every other day, and it's really not the best thing for us psychologically to deal with so much of bad news any given day. It doesn't even feel like a vacation anymore when you're locked down with your family, although people say you should make the most of your family time. But when you're subjecting yourself to all these new feeds, it really starts affecting you and really affects your anxiety level. So, what advice do we have to deal with this during during this
Yeah,
period?
I'm sure mental health has really tanked all over the world, but I think our focus should be on the positive side and not on the negative, because at least do what we can do based on the science and data that's available. Don't focus on the unknowns, because when we focus on the unknowns and we are so uncertain, then we just kind of get sucked into that hole. So now we know good hand washing and sanitizer and the mask, all that prevents the spread and it's slowing the curve. So we should also follow the CDC guidelines and also listen to Dr. Fauci when he talks, instead of getting all unnecessary messages from WhatsApp and Facebook, and follow what is recommended. Also, like, have a timeout. Don't be on television all the time. At least don't be on the news channels all the time. Maybe update yourself once a day. Hey, that's good enough. I don't think there's going to be a lot changed if you miss watching TV for a day or two, especially the news. Watch the non-news channels, and also take care of your sleep patterns. You know, this is a time where we can really reset our sleep patterns, eat healthy, learn a craft, go outdoors, do some activity with the family, maybe teach your kids a new art or craft. You know, there's so many things. There's no end to this. And of course, there's Pinterest to be even to get more ideas about so many things. There's endless things.
Sure.
So try to focus on the positive and not the negative.
Nice, nice. That's great advice. Well, that is pretty much all the questions I had for you, Dr. Man. It was such a pleasure talking to you, and I'm glad you could come back on a short notice and just walk us through all these conversations. Thank you so much. And to everybody else, we want to request you to go ahead and like and comment on our video, and keep in touch with all the activities that's happening in the Indian Association of Natural, as mentioned below. Before we are committed to working with you and providing you as much support and help that we can. So thank you so much. You have a fabulous evening, Dr. Mon.
Thank you so much, Amrita. And, you know, together, if all of us do what we are supposed to do, we will definitely fight this pandemic. And I think next year we'll probably look back and say, hey, wow, we've gotten through this. So we just pray and hope that there are great drugs going to be made and the vaccine will come through too. All right, take care, you all. Bye-bye.
Thank you so much. Bye-bye.